Okay, and we're recording.
All right.
So this is the Let Me Hear Your Voice podcast with Whitney Schneider and Kim or Kimberly. How do you want to? Miss
Let's just
Kim.
Miss Kim. I go by all of the above.
Well, I know my child and many other children know you as Miss Kim, and that's even how Zach and I refer to you as Miss Kim. So,
It's a lot easier to say than Kimberly. It doesn't have the R or the L in it. It's not multisyllabic. It's a single syllable word.
Kim, Miss Kim.
Yeah, Miss Kim.
Very definitive.
Yes.
And this is really just about a mother of a special ed child and a speech path, and kind of our insight to communication, advocacy, progression, and integration for our special kiddos with special needs.
Absolutely. And I think too, all of those things, and really the important piece for me is the relationship for me as a therapist with my families and our journey together. It's so critical and important to the progress, the amount of progress a child makes. And we'll get into that.
100% agree. So I'll go just real quick as far as like who I am, and then we'll have you introduce yourself too.
Perfect.
So Whitney Schneider, a mom, a professional. So I'm a trainer and both in person and online. And, I had a normal pregnancy and seemingly normal baby and upbringing until Ezra's diagnosis, which I'll get into a little bit later, but that's primarily, who I am, and now I'm just a bigger advocate of, raising the voice of these kiddos who are not quite heard yet.
For sure. I can attest to that for sure. My name is Kimberly Williams. I am a speech language pathologist. But before that, and very important role for me is being a mother and a wife. I've been a speech pathologist for 16 years now. So I'm a mother of 3. I've got a kiddo in college. Well, he's an adult now. I've got a teenager in high school, and I've got an elementary age child, 10 years old in 5th grade. And I just keep busy as a wife, a mom, and a speech pathologist.
Awesome.
Yeah.
So just real quick in terms of our story and how we met. So again, so my son Ezra is 5.5 now. And it wasn't until after his second birthday that we noticed some regressions between 18 months and 2 years, but it wasn't until after his second birthday that his daycare provider at the time had said, I noticed that he's losing words, whereas a little girl his age was progressing. I think that maybe you should seek out some potential evaluation. So we utilized Tiny K here in town, got on the wait list, which if you're a child or a parent of a child with special needs, the wait lists are endless. But anyway, got on the wait list, got him evaluated. I thought that he rocked his evaluation, thought no way he's going to need speech therapy. And sure enough, he qualified. And then it was a couple months later that he started receiving services. And then it was just a few months after that, and I was pregnant with our second, that Zach, my husband, had thought that we should look further into like an autism evaluation. So we went ahead and got on the wait list. And 6 months later, from that moment, he got his autism evaluation, which I thought he did great at, and he, just did all these things that he'd never done. And then come to find out, we got an autism diagnosis. He got an autism diagnosis, global developmental delay. absent seizures, hypotonia, things that we just like were not even on our radar at all. And we left that evaluation with just a pamphlet of things to look through and a whole lot of tears from me. Um, but also two beautiful and healthy children. So I won't negate that. But I was looking into early intervention as soon as possible, and the first thing that I could get was music therapy through a gal we know, and then she gave me one person's contact information, and that person was booked. She had no room, and that was actually for ABA therapy. And then your name came across not too long after that for speech therapy, and we got on it, and we've been seeing you now for a couple of years.
Yeah. And so your music therapist is the one who gave you guys my name.
Yes, and I don't know that you guys knew each other at the time.
No, and I was trying to figure that out, and it really is, Whitney, it was word of mouth, because
Mm-hmm.
I know, I now know your music therapist, but at the time I didn't know her. And I thought, you know, how in the world does she know me? And it was really through another speech pathologist who I work closely with. And she knew that I was venturing out on my own. So I guess that's a good segue into kind of how you and I came together on my end.
Right.
I was working for the Lawrence Public Schools, and had been for, 14-ish years. And about 2 years prior to, I would say probably a year and a half prior to you and I connecting, I was just thinking, I don't know if public schools is right for me anymore. I didn't have the freedom to do what I wanted to as a therapist. There were limitations that were put on me. And when I say that, I mean, they're for good reason. I mean, there are safety measures in place and laws in place to help children be included in the general education. And this will be a conversation for another time on how all of that works. But, I didn't have the freedom to do everything that I wanted to do. I
Well, and
didn't.
for it to be like really individualized, right? Like, because you have these parameters, but these kids don't fit in these parameters. They are.
Exactly. Everything's data driven, and it needs to be data driven.
Mhm.
But some things, when we're talking about communication, aren't black and white. It's very abstract and it's very gray. And sometimes it's hard to measure with data. And, that data has to show that a child is significantly different than their same age peers. And that, we have to prove that, hey, I'm going to pull your kid out of the general education environment, meaning in the classroom with same age peers. I'm going to pull them out so they can receive these special services. Well, when you're working for a school district, you have to show that, listen, there is nothing else that general education teacher can do. There is nothing else anyone else can do in that classroom. So you've got to prove why you're pulling them out. And I understand that, because we don't want to be pulling kids out all the time if they don't need to be pulled out. There's benefits from being in the classroom with same age peers. But at the same time, these kiddos with special needs, it's all about early intervention.
Absolutely. Well, they hammer that. I mean, the professionals hammer that time and time and time again. And
Yeah.
that's all that I was ever. That's why I was so adamant about getting something, anything. And man, just so grateful that it was you that came along. Um,
Me too. I mean, Whitney, you know, just thinking back, and I know you and I have talked about this before, but I remember getting the phone call from you. Um, I remember where I was. I was in my car driving, and um, asking you questions because I didn't know you. I didn't know Ezra, and just trying to figure out a little bit about who he was and where he was at. And I just remember talking to you and asking you about, what is he interested in? What kind of things, like, because I was trying to figure out what can I bring to him, bring to you guys to help get elicit communication from him. And there just wasn't a whole lot. I mean, it was just, I kind of felt like, for me, from my perspective, when I was listening to you, what I heard on my end was, I just don't know. I know he has this diagnosis. That's what I heard. And I don't know if this was true or how you were feeling. But for me on my end, what I heard was, I don't know what to do. We were given this diagnosis. He needs speech services. That's kind of where we're at.
Yeah, essentially. And you talking about that, I kind of remember you asking like, what were some of his favorite things and what was he into? And not really anything specific. There wasn't anything to like really draw his attention or like draw any sort of speech and communication out of him. It really, I know that for us in the beginning, what was really beneficial was putting things out of sight or out of reach so that he had to ask for things that he wanted, because otherwise it was all just fair game. And two, he could just, take it without asking, without having any verbal communication. So we really had to kind of set things up for success, and
For sure.
with a lot of intention and a lot of thought behind it, which, most parents, well, I don't know about most, but generally that's not something that is thought about, because
I,
it comes naturally. Whereas whenever you are fighting for those words and searching for those words, it's got to come from a place of want or a place of need for them.
Absolutely. I mean, it's very intentional, structuring the environment and structuring every single opportunity for communication so that these kiddos, our kiddos, can learn the power of communication.
Yeah. And, I remember you came over with like a bag of toys. And, I also like, you came over after school hours. You were working some long days with children of your own too. So that was a real testament to me on your behalf of just your desire and overall love really for your profession and for the kids that you serve. And that's where, in my opinion, the private speech sector just shines through, because we get to really see that. We really get to witness that as parents, and watching and paying attention to our child respond to you. Again, we're going to get into that, I think, a little bit, maybe our next podcast, regarding why private and in-person speech therapy is just so instrumental in the progression of these kids.
Absolutely. I look forward to talking with you about that. And I know you and I have been on this journey for 2 years. So that'll be a good conversation to have. And just to touch back on what you were saying, when I came after school hours, I was working for the school district when we first met, but I was dipping my toe in the private sector world of speech pathology to see if I was ready and could do, it was never a question of, can I do speech therapy? I know that I can do speech therapy. I feel very confident in that. But, when you're going out on your own, and you're a business owner too, it's a little bit nerve wracking, and it's like, oh my gosh, there's risks involved. It's not just the, can I do speech therapy? It's, what about all this business stuff in the background that I have to deal with as well,
Absolutely.
So,
Like I've told you before too, I originally started as a trainer in a big box gym, and it didn't take me long to figure out that was not going to be the right space for me. But, going out, like, how am I going to find clients, and who will refer me?
yeah.
But it's worth it's worth overcoming that fear. And now, you're still, amazing at your job, and you're seeing a lot of success with your clients, but you're also doing really well. You're staying pretty busy.
Yeah, I'm staying busy. What I love about, and I'll tell you, Whitney, even just like coming over with my bag of toys, that even that first session when we met, it was one-on-one. It was me, you, and Ezra. I was there to answer questions. You were there to answer questions. You and I were able to have a conversation. And, your boy better than anybody, right? So when I'm in there and I'm asking, hey, like, I could come in and work with him, but you know him, right? So I know speech pathology, your boy. So when I'm in there and he would do something, I'm looking at you going, Whitney, tell me how you handle it in a situation like this, or help me understand this. It was total from the very beginning. And this is what made me decide. I mean, this was a huge piece of, I don't want to be in public schools anymore. I want to do my own thing, because one of the biggest pieces of helping a kiddo progress is my relationship with the family. And it was evident from day one when we first had our session, because you were sitting on the bed. I think you were actually on the floor. You even had your phone out. You were videotaping parts of what we were doing. I mean, how huge is that? It's like, let's go back and watch this later. And those videos, man, it's like, sometimes I'll go back and I'll look at it and I'm like, man, that was pretty awesome. Or, ooh, I think I'm going to do that different next time.
Well, that's all a part of it too. Like we're learning, but I do want to, you said that like your speech path and you're good at that. And like you came over with your bag and, you're doing your work and you're asking for my opinion. And on the opposite end, as a parent, I'm sitting there like, I don't know what she's doing, but I'm paying attention, and I'm going to try to, reiterate that because I see that it's working. Even within that first session, I saw and heard, which is the point, heard words and communication, and saw him, trying to communicate. And that was all from your prompting and your expertise within, your field. That's not mine, and it's not mine as a parent. And, I used to say that like, that's not my job as a parent, but it is my job to continue to facilitate his progress and growth. And that's going to be, sitting back, listening, paying attention to the professionals, and integrating it into our daily lives and our household.
I mean, I absolutely love hearing that, because, I can come in and I can work with a kiddo once or twice or 3 times a week. But if this kiddo's mom and dad, if their family doesn't know what I'm doing with that child, they can't implement it when I'm gone. And that's the beauty of private therapy, is you get to be part of it, and you get to take the reins after I leave. And while you're not a speech therapist, you're an advocate for your son. You're invested in helping him be the best he can be, that push for independence. And when I leave, whether I hear you saying, I didn't fully understand maybe the whys of what you were doing, but it was working, and then you leaned into it and you did it, the evidence shows in his progress, and it's huge. And that's why and I don't want to get too in depth with it, but because we can do that in our next podcast, but the whole partnership, the whole collaboration of a therapist and the family, the investment that we have together, it's monumental in the child. And
well, yeah, you bring one part, I bring one part, and then, we mold that to fit his needs. And 100%. You do that, I'm sure, with every child and every family, because it's specific to them. And I'll tell you, let's see, that would have been 2 years ago, almost probably this month coming up.
Oh my gosh.
And I remember April of that year talking to friends saying like, I just want to have a conversation with my son. And now I can.
Yeah, that's a true story. That's a beautiful thing. That gives me goosebumps.
So thank you for all of that. That might be a good place to end. And we will continue on with more of it next time. So thank you so much for your time.
Thank you, Whitney. I look forward to it.
All right. Bye.
Bye.